Medicine evolves. What your doctor learned in medical school 20 or 30 years ago is not always what the latest research says today. I am not here to criticize doctors, I am one. But I am here to tell you that some of the advice still being handed out to patients over 55 is based on outdated guidelines that the science has quietly moved on from. And if nobody updates you, you keep following advice that is no longer serving you. So today, I am going to walk through 5 common pieces of medical advice for people over 55 that the research has significantly changed, qualified, or reversed entirely. Number 1, your cholesterol is high. You need to cut out all fat. This was the dominant message for decades. Fat raises cholesterol. Cholesterol causes heart disease. Cut the fat. The problem is that this was an oversimplification that the science has spent the last 20 years walking back. We now know that dietary fat is not a single thing. Saturated fat from processed food behaves very differently in the body than fat from olive oil, avocado, or nuts. More importantly, we now understand that the relationship between dietary cholesterol and blood cholesterol is far more complex than was originally believed. For most people, eating eggs does not meaningfully raise cardiovascular risk. Cutting all fat, particularly the healthy unsaturated fats, can actually lower HDL, which is your protective cholesterol, and increase inflammation. The current evidence supports a diet rich in healthy fats, not one that eliminates them. Number 2, your bone density is low, take calcium supplements. Were prescribed widely for decades to prevent osteoporosis in older patients. The logic was simple. Bones need calcium, so supplement it. But in recent years, multiple large studies have raised a serious concern. Supplemental calcium, particularly in doses above 1,000 mg per day from pills, may increase the risk of arterial calcification and cardiovascular events in older adults. This does not apply to calcium from food, which the body absorbs and uses very differently. The current thinking is that calcium from dairy, leafy greens, sardines, and fortified foods is safe and effective, while high-dose calcium pills for people who eat a reasonably balanced diet may carry risks that were never properly communicated to patients. If you are taking a calcium supplement, this is worth a specific conversation with your doctor about the dose and form. Number 3, you should avoid exercise if your joints hurt. Consideration pertinent. This advice was given with good intentions, and it is almost entirely wrong. The fear was that exercise would worsen joint damage in people with arthritis or joint pain. What the research now clearly shows is the opposite. Movement is medicine for joints. Cartilage does not have its own blood supply. It receives nutrients and oxygen through the compression and release that happens during movement. Sedentary behavior accelerates joint degeneration. Controlled, low-impact movement, walking, swimming, resistance training, and cycling reduces inflammation, strengthens the muscles that support joints, and in many cases significantly reduces pain over time. If your doctor told you to rest your joints and avoid exercise, please get a second opinion from a physiotherapist or sports medicine specialist. Number 4, a glass of red wine a day is good for your heart. This one was repeated so often it became cultural wisdom. Red wine contains resveratrol. Resveratrol has antioxidant properties. Therefore, red wine protects the heart. The problem is that the evidence for this was largely observational, and more rigorous recent research, including Mendelian randomization studies that remove confounding factors, has consistently failed to confirm that alcohol provides a net cardiovascular benefit. What we actually see is that moderate drinkers tend to have other healthy behaviors that explain better outcomes. The alcohol itself, at any dose, increases the risk of several cancers, including breast cancer in women, and affects liver function, sleep quality, and blood pressure. The current medical consensus is that there is no safe level of alcohol that is medically recommended. If you enjoy wine socially, that is a personal choice, but your doctor should not be recommending it for your heart. Number 5, your blood pressure of 140/90 is fine for your age. For many years, guidelines accepted higher blood pressure targets in older patients, the reasoning being that some degree of elevation was normal and necessary with age. The SPRINT trial, one of the most significant cardiovascular studies of the last decade, changed this thinking dramatically. It showed that targeting a systolic blood pressure below 120 rather than the previously accepted 140 significantly reduced cardiovascular events and mortality in adults over 50. Many physicians have updated their practice accordingly, but some have not. If your doctor has told you that 140 over 90 is acceptable for your age and has not discussed more aggressive management, it is worth asking the question, based on current guidelines, is my blood pressure target optimal for my cardiovascular risk? I want to be clear about something before I finish. None of what I have shared today is a reason to distrust your doctor or stop following medical advice. Medicine is a human endeavor. It evolves, and good doctors evolve with it. What I am giving you today is information you can bring to your next appointment. You are allowed to ask questions. You are allowed to say, I read that the guidelines on this have changed. Can we talk about it? The best medical care is a conversation, not a one-way instruction. You deserve to be part of that conversation. Share this video with someone over 55 who has been following the same advice for years without ever questioning it. It might be exactly what they needed to hear.